getting the people that cannot afford to pay lump sum to actually join shift through a tax on either their power bills or their mobile calls, because that's the way to make them actually not feel the burden and actually to loop everyone in to be to actually have the medical cover. Thank you.
Thank you, Esther. Minister, you hear the passion of the Nairobi women rep. You agree with her?
Thank you, Honorable Speaker and Honorable Members. Honorable Pasaris is my friend, and on many occasions she has come to bring me ideas of what we need to do at different levels. The issue of out of stock of the drug for H. pylori at Mama Lucy, I think we have the drug at KEMSA. So then that is a supply chain issue between how stocks or products move from KEMSA to other facilities. But that can be looked at, and I will defer then the question to the governor of Nairobi, so that then they are able to explain the discrepancy, why the gap that we have the drugs at KEMSA, but they are not available at Mama Lucy. On the issue of fistula, Honorable Speaker and Honorable Members, one of the things that we need to do is to educate, because the most prevalent source of fistula is for young girls who get pregnant and their organs are not yet mature really to hold babies. That is how they end up then with fistula in most cases. So it's to empower girls, especially from the less privileged, so that then they can go to school, they can understand what are the repercussions of some of these things, and so that we get a sustainable solution to it. We also understand, Honorable Speaker and Honorable Members, that there are many factors to cancer.
Hold, Minister. Yes, Esther, is there a problem?
Honorable Speaker, with due respect, during the time of the pandemic, we had over 300,000 girls that were defiled, all right, and became pregnant. So those girls actually, because safe abortion is not permitted, and we've not released the regulations and trained people on safe abortion, what happens is those girls are forced to actually have those children and end up with fistula. So we should actually not look at behavioral circumstances leading to fistula. A lot of the people that suffer from fistula today is from sexual gender-based violence, and young girls having fistula is because of rape and defilement. So we need to make sure that we provide fistula operations, or we provide safe abortions for the young girls who are 10, 11, 12 and cannot. And the only reason we cannot provide safe abortions right now is because we have not released the regulations of safe abortions, and yet abortion is permitted by law when the doctor sees that the patient should have safe abortion. So at the moment, I think it's wrong to assume that it is behavioral characteristics of a girl that leads to fistula. I know lots of women who have delivered and they have small passages and they still have fistula, and those who are probably in marriages. So the women that I'm dealing with right now that have fistula are married women, and it can come through surgical procedures gone wrong too, and inflammations through urinary UTIs.
You've made your point. Minister?
Honorable Speaker and Honorable Members, I do understand, being a woman, the passion of Honorable Esther Pasaris on this issue. But I want to confirm that as the ministry, we are guided by the Constitution. And thankfully, we are speaking in the House that is responsible for making the laws. So as it stands, abortion in Kenya is not allowed unless it is determined that the life of the mother and the child are at risk, and that has to be determined by a medical practitioner. So when that is amended, then the ministry will be able to take action based on that. But I want to thank Honorable Pasaris and invite her to my office so that we can have deeper conversations. Thank you, Honorable Speaker and members.
Last on this, Wamuchomba. Member for Githunguri.
Thank you, Mr. Speaker. I rise to ask question number 1010 to the Cabinet Secretary for Health. Could the Cabinet Secretary clarify whether the National Health Insurance Fund, that is NHIF, has ceased remitting funds to private hospitals for provision of free maternity services? And if so, what steps are being taken to ensure continued access to these services by pregnant women, and particularly from low-income backgrounds? 2, explain the measures taken to ensure the continued operation and access to free maternity services under the Linda Mama initiative, particularly in the light of Social Health Insurance Fund, yet to be fully implemented. And 3, provide details on how the Social Health Insurance Fund will facilitate comprehensive access to reproductive health care for women. Thank you, Mr. Speaker.
Thank you, Minister.
Thank you, Honorable Speaker and honorable members. This is the question that ties up to the question that had been asked by Honorable Zamzam, and I wish to respond as follows. Honorable Speaker and honorable members, the free maternity services are financed by the Exchequer through National Hospital Insurance Fund on a fee-for-service arrangement. The fund has not ceased remitting funds to private hospitals for provision of these services, and mothers continue to get services from contracted facilities. Facilities, in turn, bill National Health Insurance Fund thereafter. However, there has been a delay in remittance of Exchequer from the National Treasury. The Ministry has engaged the National Treasury for release of 4.098 billion owed under the Linda Mama scheme. The Ministry has this week received a confirmation from Treasury on release of a total of 5.5 billion for NHIF, and of these, 2.5 billion is for Linda Mama. If we receive this 5.5 billion within this week, then payment of claims for Linda Mama will start from next week. On the second issue, explain measures taken to ensure the continued operation and access to free maternity services under Linda Mama initiative, particularly in the light of Social Health Insurance Fund, yet to be fully implemented. Honorable Speaker and honorable members, the government enacted the Social Health Insurance Act 2023 to provide a framework for improved health outcomes and financial protection in line with the right to health and universal health coverage. The Act establishes the Social Health Authority that will manage the Primary Health Care Fund, Social Health Insurance Fund, and the Emergency Chronic and Critical Illness Fund. Maternity services have been provided as part of the scope of the benefits package to be accessed under Social Health Authority. To access the benefits package under Social Health Authority, all Kenyans are expected to register with Social Health Authority in line with the Social Health Insurance General Regulations of 2024. Benefits under SHA will start to be accessed from the 1st of July 2024. However, NHIF continues to operate, so there is no gap, and we are ensuring that there is a seamless transition. The government also recognizes that we have low-income households who may not be able to raise the minimum amount of 300 shillings for Social Health Authority. The government will, in this regard, pay premiums for these households who may include pregnant women in order to enable them access maternity services. This is in line with Section 27, Part 2C of the Act, which provides that in the case of households in need of financial assistance, as determined by the government at a rate appropriated by Parliament and county assemblies for that purpose, as prescribed under this Act. Part 3, provide details on how the Social Health Insurance Fund will facilitate comprehensive access to productive health care for women. Honorable Speaker and honorable members, the Social Health Authority will facilitate comprehensive access to reproductive health care for women by providing explicit listed benefits accessible at Level 2 and Level 3 health facilities and at no cost to the member through the Primary Health Care Fund, which is fully financed by the government. A list of the benefits package of maternity services to be accessed through Primary Health Care Fund and Social Health Authority has been annexed to this presentation, and we shall leave it behind. Some of the benefits include access to family planning, antenatal care, pre- and post-delivery visits, deliveries, that is normal delivery and cesarean sections, complications related to deliveries. Just before and after the launch of the benefits package, the authority will invest in massive communication campaigns to inform mothers and all Kenyans of their entitlement to these benefits. Honorable Speaker and honorable members, I am aware that some members are thinking that Linda Mama has been scrapped and therefore there's no benefit for women. Honorable Speaker and honorable members, I wish to confirm that myself, I am a mother of 2, and indeed, I am aspiring to be a mother of 5. Therefore, the existence of Linda Mama will therefore ensure that all benefits under Linda Mama are ring-fenced, not just for myself as an aspiring mother, but for all the women of this country. Honorable Speaker and honorable members, I submit. Thank you.
Wamuchomba. Let the questioner.
Thank you, Mr.
have the
Speaker.
first bite.
I appreciate that we have gotten some response from the Cabinet Secretary concerning Linda Mama, and indeed congratulate her for aspiring to be a mother of 5 in the near future, and wish you well. However, Mr. Speaker, yesterday morning I visited a facility, a private facility in Kiambu County, after a few women alerted me that they have been apprehended in hospital because they were not able to pay for their medical care after delivery, and they held with them an NHIF card, which was not admissible. I had to plead with the hospital to allow the mothers to leave the facility and gave my personal guarantee that should they not be able to take care of their bills, I will do so as a mother. And therefore, when the minister tells us that she acknowledged that there has been a delay of remittance of some fund from Exchequer to some private facilities, she's right. And she says she's hopeful that that remittance is going to be done as soon as possible. She says this week.
Ask your
So the question is, what remedy should you give to such a mother who called me yesterday? What is she supposed to do when she goes to a hospital